Hi classmates, it's LaKendria. Sorry, I'm looking a little rough. I had to work today. Okay, so throughout this course, SLO number 2 and EPSLO number 2 helped me move from doing nursing tasks to truly using clinical judgment model and the nursing process to guide my decisions across different patient situations. When I care for patients with sensory perceptual disturbances, I now think beyond just charting hard of hearing or visual impairment. Using the clinical judgment model, I first recognize the cues like missed questions, confusion, and unsafe mobility. I analyze how those cues affect functional health. Can this patient safely walk to the bathroom? Do they really understand their discharge instructions? Then I prioritize safety and communication generates solutions such as using hearing aids, written materials, interpreters, or better lighting. And I take action by adapting my teaching and environment. I evaluate the outcomes by checking if the patient can repeat back the instructions or navigate the room safely. With chronic illness, I am more intentional about interpreting functional health in developmental stages before deciding what is realistic for the patient. For example, when I care for an older adult with heart failure and diabetes, I assess not only symptoms in labs, but also mobility, support systems, and health literacy. Using the nursing process, I collect data, identify problems like ineffective health management, plan goals that fit their life, such as daily weights and they can actually perform. And I use evidence-based teaching about the diet, medications, adherence, and when to seek help. End of life was challenging for me. I've learned to interpret cues by spiritual distress, family readiness, and cultural beliefs, not just pain scores and vital signs. I recognize when aggressive treatment is no longer consistent with the patient's goals, when comfort and dignity should become the priority. By applying clinical judgment model, I recognize and analyze both verbal and nonverbal cues, prioritize comfort and communication, generate options like palliative consult or family meetings. And then, let me see. Then I evaluate whether the patient and family feel supported. This course has helped me see the end of life as a time where safe quality care means honoring values as much as treating symptoms. Overall, I feel like I am beginning to live out EPSLO number 2. I use the nursing process, assessing functional health and development, diagnosing real problems, planning evidence-based interventions, implementing them through thoughtfully and evaluating outcomes. And the clinical judgment model has given me a clear way to think through recognizing and analyzing cues, prioritizing what matters the most, and adjusting my actions for patients and sensory perceptual disturbances, chronic illnesses, and end-of-life needs. I am more aware that safe quality care across the lifespan depends on how well I interpret the whole person in front of me and not just the diagnosis and task list. Thank you.